Good afternoon. I'd like to thank President Trump for inviting us to the White House today. We are grateful for his incredibly strong commitment to patient-centered health care reforms. I'd especially like to thank the Weir, Finn, Acheson, and Witzig families who are with us today to tell their stories. The uncertainty and hardship that each of them have faced in confronting your family's health challenges are a vivid reminder for all of us why inaction on this problem is not an option. Right now, Obamacare is failing to deliver for the American people, and the folks here in this room today are a stark reminder of that problem. Principles of health care are pretty clear: accessibility and affordability and quality and choices. You all represent millions of Americans for whom those principles have been violated. And it's because of your voices and your experience that we're here today to urge Congress to give the President a bill to sign. The President has laid out a positive vision for how to fix this mess by putting patients and families and physicians in charge of health care decisions, not Washington, D.C. We are committed to ensuring that the American people enjoy a health care system that works for them. The President has made that crystal clear. And an individual who, just like the President, has been working day and night on getting this accomplished is the Vice President. He understands the imperative of patient-centered health care. And it's an honor to introduce to you my friend, the Vice President of the United States, Mike Pence.
Well, thank you, Dr. Price, and good afternoon to all. To the families who are gathered here from all across America on behalf of the First Family, welcome to the White House. Since the first day of this administration, President Donald Trump has been working to keep the promises that he made to the American people, to rebuild our military, revive our economy. And this president has worked tirelessly to repeal and replace Obamacare. President Trump knows that every day Obamacare survives is another day that American families and American businesses struggle. As we've traveled across the country, we've heard firsthand from Americans just like those who stand behind me today, from families who are bearing the cost of skyrocketing premiums and plummeting choices, from families who've lost their doctors, lost their insurance, and from families who are starting to lose hope that Congress will ever respond. But as I've told every one of them and people all across this country, thanks to the leadership of President Trump, help is on the way. President Trump hears you. He is fighting for you, and he will keep fighting every day until we give the American people access to the world-class health care they deserve. Tomorrow, the United States Senate will have the opportunity to begin the debate on a bill to repeal and replace Obamacare. And as the President said this morning, after years of talking and campaigning on it, now is the time for Republicans in Senate to act. Republicans in the Senate will have, in his words, a chance to do the right thing, to keep their promise to the American people and these families and families all across this country. And this president and the American people are counting on the Senate to act. So, with gratitude for his leadership and his persistence and determination to make American health care great again, it is my high honor and distinct privilege to introduce to these families and to all of you the 45th President of the United States of America, President Donald Trump.
Well, thank you very much, Vice President Pence, Secretary Price, and thank you, everyone, for being here today. For the past 17 years, Obamacare has wreaked havoc on the lives of innocent, hardworking Americans. Behind me today, we have real American families, great families, just spent a lot of time with them, who are suffering because 7 years ago, a small group of politicians and special interests in Washington engineered a government takeover of health care. Every pledge that Washington Democrats made to pass that bill turned out to be a lie. It was a big, fat, ugly lie. Democrats promised Americans like Steve Finn, a former police officer in West Virginia, that they would save $2,500 a year under Obamacare. Instead, his premiums have more than tripled. That's pretty bad. As a result of Obamacare's skyrocketing costs, Steve and his family and many of his employees had no other option than going on Medicaid and giving up their existing coverage. That's pretty bad. Pretty bad. No choice, right? No choice. For them, Obamacare's promise was a nightmare. Marjorie and Kevin Weir from South Carolina have a son, Monty, who suffers from spina bifida. Washington Democrats promised families like the Weirs that if they liked their doctor, they could keep their doctor. But now there is only one insurer left in the state exchange. And Marjorie says that every year she waits anxiously to learn if the doctors and hospitals, which her son needs the most, will remain in their network. More Obamacare lies. And you've seen that up front, unfortunately, up front and personal. The Democrats promised Melissa Atkinson that her son's pre-existing conditions would be covered. The Atkinsons quickly learned that Obamacare's promise of covering for pre-existing conditions was meaningless, though if the doctors you need to care for you aren't on your Obamacare plan. So you just have a meaningless promise, and everybody knows it, and most people on Obamacare know it. After an excruciating series of events and complications, Melissa and her husband found themselves, just before Christmas, emotionally and financially devastated, crying in a doctor's office faced with yet another seemingly unpayable bill. When insurance wouldn't cover the Atkinsons' care, they emptied out Melissa's 401k to pay their bills. They're not going to be, and they haven't been the first. There are many, many cases such as that, the 401ks. The first rule of medicine is do no harm. But Obamacare's lies have caused this, and throughout the whole country, families like this, nothing but pain. Aaron and Andy Witzig are small business owners from Illinois. They have 6 children. Their youngest daughter, Poppy, has a rare genetic condition. Children born with it are sometimes called butterfly children because their skin is as fragile as the wings of a butterfly. Poppy has to wear special bandages all of the time. Unfortunately, under Obamacare, Poppy's insurance has been repeatedly discontinued and replaced with what Washington deems equivalent policies. But for Poppy, these plans are not equivalent, and Poppy's family has to spend precious time and tremendous resources fighting for exceptions for Poppy. The Washington politicians who made those promises to Steve, Marjorie, Melissa, Aaron, and their beautiful children want to ignore all the pain, all the suffering, and all of the money, the tremendous amounts of money that these lies have caused. They want to forget about the countless Americans they've hurt and the many that they are continuing to hurt every day by refusing to help us replace Obamacare. For the last 7 years, Republicans have been united in standing up for Obamacare's victims. Remember, repeal and replace, repeal and replace. They kept saying it over and over again. Every Republican running for office promised immediate relief from this disastrous law. We as a party must fulfill that solemn promise to the voters of this country to repeal and replace what they've been saying for the last 7 years. But so far, Senate Republicans have not done their job in ending the Obamacare nightmare. They now have a chance, however, to hopefully fix what has been so badly broken for such a long time, and that is through replacement of a horrible disaster known as Obamacare. The Senate is very close to the votes it needs to pass a replacement. The problem is we have zero help from the Democrats. They're obstructionists. That's all they are. That's all they're good at, is obstruction, making things not work. They say all the right things, and then they do exactly what they're not supposed to be doing. The Democrats aren't giving us one vote, so we need virtually every single vote from the Republicans. Not easy to do. The Senate bill that is being considered outside of the outright repeal of Obamacare will also provide emergency relief for the law's victims, and it will deliver truly great health care and health care reforms that our citizens want, need, and really should be demanding. Some are demanding. You'll see that at the voter booth, believe me. Here are just some of these terrific reforms that we will be doing if everything works out the way it should. The Senate bill eliminates the painful individual mandate. It eliminates the job-killing employer mandate, repeals other burdensome taxes, and will significantly lower Americans' premiums. It will stabilize collapsing health insurance markets and give Americans far more choice and far more flexibility. The Senate bill protects coverage for pre-existing conditions, and you don't hear this from the Democrats. They like to tell you just the opposite, and they didn't even know the bill. They run out, they say death, death, death. Well, Obamacare is death. That's the one that's death. And besides that, it's failing, so you won't have it anyway. It dramatically expands popular health savings accounts. It provides tax credits so Americans can purchase a private plan that is right for them and their families. It devotes substantial resources to fight the opioid, and this is a tremendous problem, the opioid epidemic. $45 billion is being put in so that the people of many states like New Hampshire, Ohio, and so many others that have such a big problem can be helped, and helped greatly. We're going to be fighting the drug problems very, very seriously in my administration. And it provides, among many other things, higher quality care and more flexibility for states to administer Medicaid to better serve their poorer citizens. Tomorrow, the Senate will vote on whether to allow this urgently needed bill to come to the Senate floor for debate. The question for every senator, Democrat or Republican, is whether they will side with Obamacare's architects, which have been so destructive to our country, or with its forgotten victims. Any senator who votes against starting debate is telling America that you are fine with the Obamacare nightmare, which is what it is. For Democrats, this vote is a chance to make up for the terrible harm they have inflicted on Americans like those who are with us today. Obamacare has been for them a nightmare. There is still time to do the right thing. And for Senate Republicans, this is their chance to keep their promise. Over and over again, they said repeal and replace, repeal and replace. But they can now keep their promise to the American people to provide emergency relief to those in desperate need of help and to improve health care for all Americans. To every member of the Senate, I say this: the American people have waited long enough. There's been enough talk and no action. Now is the time for action. We are here to solve problems for the people. Obamacare has broken our health care system. It's broken. It's collapsing. It's gone. And now it is up to us to get great health care for the American people. We must repeal and replace Obamacare now. Thank you. God bless you. God bless the United States of America. Thank you very much. Thank you. Thank you.
anyone wondering how involved President Trump was going to be on pushing through health care reform, there you have it. An impassioned address from the president there on the eve of a potential Senate vote tomorrow on health care reform as part of Republicans' larger plan to repeal and replace the Affordable Care Act, otherwise called Obamacare. You see there President Trump, Vice President Pence, and the HHS Secretary Tom Price after their address, shaking hands with some of the families who've gathered there in the White House. And back here in New York, let's talk a little bit about what the president had to say there and what we know to be true about Senate and their potential vote tomorrow. Let's bring in my colleague Mary Alice Parks down in Washington, D.C. in our network bureau there. Mary Alice, one of the big questions a lot of people had for the last few weeks was how involved was President Trump going to be? This is the first time we've heard him deliver this kind of address, but he did put a lot on the line for both Republicans and Democrats in that plea.
Right, you're exactly right. This is the first time we've seen the president out there really promoting the provisions of this bill, really advocating for the replacement plan that Republicans have put forward. It's been one of the biggest frustrations for Senate Republicans that he hasn't been out there campaigning, sort of pushing their bill. You know, he's using time during interviews to talk about his attorney general and not talk about health care. And so this was really interesting. You're right, talking specifically about families, there with children, talking about specifics in the bill. This was new for him.
So let's talk a little bit about what he did have to say, though, just from a political standpoint for a second, because that has been one of the main hurdles, right? The Republicans control Congress, and they still haven't been able to pull together the votes they need for previous versions of the bill. So let's talk about what we know will happen tomorrow. What exactly are they voting on?
That's a great question. It's what everyone's talking about here in D.C. today is the fact that they don't know exactly what they're going to be voting on. You know, the president there actually, I feel like he was making some news. He said they're going to have a chance to vote on a repeal and replacement plan. He was referring to that original Senate bill when he was going through the various provisions. I was like, oh, okay, well, I guess that's what they're voting on because we weren't sure if they were just going to vote on a repeal-only bill. You know, most likely what we've been told is they will bring what the House passed over to the Senate. They will vote to move that to the floor. That's the first hurdle for Leader McConnell, just to move some piece of legislation to the floor for further debate. And then it was our understanding senators would be able to add amendments. They would be able to add an amendment to scrap that bill and just do a clean repeal. Leader McConnell could add an amendment to scrap that bill and offer his replacement plan. We know that there are some Republican senators who have had their own possible replacement plans. They might be able to offer those as amendments. So there's just been a lot of guesswork on Capitol Hill about what exactly would go down tomorrow and where McConnell would throw his energy and his weight. But it looks like the president really wants a clean vote on that original Senate Republican plan.
And if anyone was wondering who the president's intended audience was, he made several direct remarks to his colleagues there in Congress. He spoke directly to Republicans saying, look, this is your last chance to make good on a promise many of you ran on, one that he definitely ran on, to repeal and replace. He also made a call out to Democrats saying this is your chance to make up for what he called the terrible harm that they have inflicted on the American people. But then again, he's gone back to this argument, Mary Alice, I want to get your take on this, that the problem here in terms of passing any kind of legislation has been Democrats, that they are not lending their support to Republicans' efforts here. Has that been the issue?
Well, it sort of depends who you ask. So Republicans will say that Democrats should have come on board. They should recognize that this law is failing, that people are hurting, that there are not as many choices as there should be on the individual market, and that Democrats should work with them. Democrats, on the other hand, say they're absolutely willing to work with Republicans if Republicans take the idea of repealing the Affordable Care Act off the table. If it's not done under the rubric of repeal, then they're ready to work. Chuck Schumer has actually come to the floor several times and said the door to bipartisanship is open. Let's work on repairing the law. And they've laid out a few proposals that they have ready to, as they say, they think would help improve the situation and repair the law. But so far, Republicans have been unwilling to go there. They still are constantly talking about a clean repeal. The president just last week was saying that maybe they should do a clean repeal. The president's been all over the map on this. So whether or not you can place blame on the Democrats is really hard. Like you said, Republicans own every part of this town. So the fact that they haven't been able to get their people together to vote on something really is on them.
Let's talk a little bit about his tack to his own party here, because this is something the president has been tweeting about. It's something he made direct remarks about here. Let's listen in on what he had to say in his messaging to his fellow Republicans.
There's still time to do the right thing. And for Senate Republicans, this is their chance to keep their promise. Over and over again, they said repeal and replace, repeal and replace. But they can now keep their promise to the American people to provide emergency relief to those in desperate need of help and to improve health care for all Americans. To every member of the Senate, I say this: the American people have waited long enough. There's been enough talk and no action. Now is the time for action.
Mary Alice, Republicans who'd previously opposed other versions of the Senate bill did so because there were some parts of it that are really hard to get behind, to defend to your constituents if you're running for re-election in 2018. The latest CBO estimates said that the latest version of the Senate bill, that was the July version, had an increase of 22 million additional people uninsured by 2026. Premiums initially going up, and then after 2020 going back down. That's a tough sell, Republican or Democrat. That's a tough sell to make to your constituents.
Exactly. You know, it's sort of unbelievable how much he is really separating himself from his colleagues, sort of placing the blame on them, really raking them over the coals for not getting something done. But he's not the one that's traveling back. These town halls, we remember, we've seen those pictures, really boisterous crowds of folks saying that you know, they were only able to get health insurance because of the law, especially in some of those red states that expanded Medicaid under the Affordable Care Act. You have even Republican governors saying that the expanded Medicaid really helped them provide insurance to some of the most vulnerable populations in their states. They're asking their senators to not vote for this thing. And obviously, the Republican senators don't want to get between the White House and the Republican governors. They're stuck in a really hard spot. You're exactly right. This bill has been unpopular. The polling on it is really bad. People are anxious about what it could mean in their lives. And so there are several Republicans that have just not been willing and able to support it so far.
And there are a couple of things the president mentioned there specifically that I think are sources of a lot of confusion for people. So I do want to see if we can drill down to them a little bit. There's this issue of pre-existing conditions, right? That the line has been that whatever version of the bill comes out, that will protect pre-existing conditions. From what we understand of the last version of the Senate bill, that's not entirely true, right, Mary Alice?
You're exactly right, but it gets to what version of this bill we're actually talking about.
Right.
So the most recent version of the bill, you're right, included parts of an amendment offered by Senator Ted Cruz, was designed to appeal to the more conservative parts of the caucus. That amendment would allow insurance companies to sell very, very bare bone, kind of catastrophic only plans on a separate market, free from other requirements and regulations under the current law. So a lot of experts and even some insurance companies, the American Association of Actuaries, which I wasn't even sure I knew existed, but who study rates and the health and viability of insurance markets, they all said that could create real issues if you pull healthy, younger people into a separate pool, a separate market, then they're no longer balancing the risk. And so you leave sicker people or just people who need more coverage, who have had pre-existing conditions, women who tend to want maternity care, for instance, in their own pool. And so prices would most likely really go up. And that's what the CBO found, too, that prices for those people who need more care would really skyrocket. And so whether or not you say that this bill, the latest bill, includes protections for people with pre-existing conditions, it's kind of whether you read the letter of the law versus the possible implications of the bill that they're proposing. It leaves in some language about technically protecting people with pre-existing conditions, but does a lot of funny maneuvering so that folks that actually, those folks actually that are really worried about their protections theoretically could see a lot higher costs. So it's complicated, but you're right that it's been really controversial.
It's complicated stuff. You and our whole team down there have done an awesome job unpacking it all. Anyone who wants to dig into the nitty-gritty, go to abcnews.com. There are a ton of breakdowns there, including some of the CBO estimates and how those weigh into this. But let's talk about this big picture before I let you go, Mary Alice. Look, if they cannot pull together the votes for whatever this vote is tomorrow, and again, this is evolving, so stay with us here. If Republicans can't manage to get this together, what does it say? Because this is the first big legislative tack they've taken. What does it say about the rest of their agenda?
That's exactly it. It's really hard to see them being able to convince their constituents back home that they can get something done. And a lot of what else they wanted to pass was sort of dependent on health care. The health care repeal and replace legislation included some big changes to the tax code, rolling back some Obamacare-era taxes. Well, if they can't repeal those there, it makes it harder to pass other tax reform legislation. Do they try to include those tax changes? The tax changes are tied to the budget. So there's sort of a domino effect on Capitol Hill. They were banking on being able to get this done. And if they can't, it really makes it harder for them to tick through the rest of what they want to do.
All right. Well, we'll have fun staying on top of that here. I know you will in D.C. Mary Alice Parks, always good to talk to you.
Thanks, Amna.
And thanks to all of you for watching as well. Remember, go to abcnews.com anytime to stay up to speed on the latest of this healthcare reform effort on Capitol Hill. And stay here for your latest live news happening here and around the world. For now, I'm Amna Nawaz, and I'll see you back here soon.